fatty liver disease. Over time, alcohol damages liver cells and disrupts its normal functioning. Beyond these major players, certain medications like corticosteroids and some chemotherapy drugs can also contribute to fatty liver disease. It's important to note that genetics can also play a role,
making some individuals more susceptible to developing this condition. Other less common causes include rapid weight loss, malnutrition, and certain viral infections like hepatitis C. Understanding these root causes is crucial for
prevention and early intervention. By addressing these risk factors through lifestyle modifications and medical management, we can significantly reduce the likelihood of developing fatty liver disease. One of the tricky things about fatty liver disease is that it often doesn't cause noticeable symptoms in its early stages. It can be a silent condition for years, even decades. However, as the condition progresses, certain signs and symptoms may start to surface. And one of the most common symptoms is fatigue, a feeling of persistent tiredness or lack of energy. You might find yourself feeling exhausted even after a good night's sleep or struggling to get through the day. Abdominal discomfort is another potential symptom. You might experience a dull, aching pain or a feeling of fullness in the upper right portion of your abdomen where your liver is located. As fatty liver disease progresses, it can lead to inflammation and swelling of the liver. This can cause jaundice, a condition characterized by yellowing of the skin and the whites of the eyes. Other symptoms that may arise include loss of appetite, nausea, swelling in the legs and ankles, and itchy skin. It's important to note that these symptoms can also be indicative of other health conditions. So, if you experience any of these symptoms, it's crucial to consult with your doctor for a proper diagnosis. They will be able to assess your medical history, conduct a physical examination, and order the necessary tests to determine the underlying cause. Remember, early detection is key to effectively managing fatty liver disease and preventing further complications. Now let's talk about how doctors diagnose fatty liver disease. It often starts with a simple conversation about your medical history, lifestyle, and any symptoms you might be experiencing. During the physical exam, the doctor will gently press on your abdomen to check for liver enlargement or tenderness. Blood tests play a crucial role in assessing liver health. Elevated liver enzymes, such as AST and ALT, can indicate liver inflammation or damage. Imaging tests provide a visual representation of your liver, helping doctors assess its size, shape, and any structural abnormalities. An ultrasound is often the first imaging test performed, followed by more detailed scans like CT scans or MRI if necessary. In some cases, a liver biopsy may be recommended to confirm the diagnosis and determine the severity of the condition. During a liver biopsy, a small sample of liver tissue is extracted using a thin needle and examined under a microscope. This helps assess the degree of fat accumulation, inflammation, and scarring. The good news is that fatty liver disease is often detected during routine checkups or when investigating other health concerns. By diagnosing the condition early on, we can intervene and implement lifestyle changes or medical treatments to prevent further liver damage. The good news is that fatty liver disease is often reversible with appropriate lifestyle changes and medical management. The primary focus of treatment is addressing the underlying causes and reducing liver fat. One of the most effective ways to combat fatty liver disease is through weight loss. Losing even a small amount of weight, around 5 to 10% of your body weight, can significantly improve liver health. Regular exercise is crucial for shedding those extra pounds and improving insulin sensitivity. Aim for at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity per week, along with muscle strengthening activities twice a week. A healthy, balanced diet is paramount. Focus on consuming whole, unprocessed foods, including fruits, vegetables, whole grains, and lean proteins. Limit your intake of saturated and trans fats, cholesterol, added sugars, and refined carbohydrates. If you have diabetes, managing your blood sugar levels is essential. Work closely with your doctor to adjust your medications and lifestyle as needed. In some cases, your doctor may recommend cholesterol or insulin resistance. It's important to note that these medications should be used in conjunction with lifestyle modifications and under the guidance of a healthcare professional. Remember, consistency is key when it comes to treating fatty liver disease. By adopting these healthy habits and working closely with your doctor, you can improve your liver health and prevent further complications. That was a deep dive into the world of fatty liver disease. We covered a lot of ground today, from understanding what it is to exploring its causes, recognizing the symptoms, and most importantly, the steps you can take to address it. Remember, knowledge is power when it comes to your health. By understanding fatty liver disease, you're empowered to make informed decisions about your lifestyle and seek timely medical attention if needed. If you found this video helpful, don't forget to give it a thumbs up and share it with your friends and family. Subscribe to our channel for more informative videos on health and wellness. Until next time, stay healthy.
मलाई का राजा कंट्री डिलाइट ला रहा है आपके लिए द राजा साहब।
ये घर मेरा शरीर है, यहाँ की दौलत मेरी रूह। मेरे जाने के बाद भी इसे मैं ही भोगूंगा।
हेलो हेलो भाई, थोड़ा आराम से। अपनी लाइफ तो बस जैसी तैसी है।
बोलो, क्या पाप किया है तुमने?
पाप आप कहाँ से आ गया मैडम? शाहरुख खान वाला प्यार किया है?
जिंदगी भर का वादा करके जो ठप्पे लगाने थे लगा दिए तुमने।
मैडम, शायद दारू के नशे में काट ले होगा। हे जगन्नाथ प्रभु, क्या हो रहा है? बचा लो माँ। दादा ने नानी की याद दिला दी रे पांडू।
Until next time, stay healthy.
If you've been told you have fatty liver or non-alcoholic fatty liver disease, the good news is it's fully reversible, and in this video I'll go over the exact steps you need to take to not only reverse it, but to do it quickly and start seeing changes in weeks. I will also go over actionable advice on the foods you need to eat and the foods you need to stay away from to fix your liver. And at the end of the video, I will talk to you about other steps you can take to improve your liver health, and we'll also go over the best supplements you can take to help your liver recover and go back to normal.
Hi, I'm Dr. Leonid Kim, and on this channel I discuss the most up-to-date and evidence-based information on the topics of weight loss, metabolic health, and longevity. Let's get into it. Now, to better understand how to reverse fatty liver, we first have to identify what causes it in the first place. And it's pretty simple. Fatty liver is caused by, for the most part,
Help your liver recover
overconsumption of
and go
sugars.
back to normal.
And
I am
specifically,
Dr. Leonid Kim,
fructose
and on this channel
sucrose.
I discuss the
The
most
sucrose being just table sugar that breaks down into
evidence-based
fructose
information
and
on the
glucose.
topics of weight
The
loss,
consumption of
metabolic
both
health,
fructose
and
and
longevity.
sugar
Let's
sets
get
off
into
a
it.
whole
Now, to better
cascade of
understand how to
changes in our
reverse fatty
bodies.
liver,
the leads to not only fatty liver,
it in the first
but
place.
also to
pretty
other
simple.
conditions like diabetes,
Fatty liver is
heart
caused
disease,
by, for the most part, to help you
even many cancers. Now, what makes fructose unique is
overconsumption
it
of
doesn't
sugar.
stimulate
Specifically,
leptin, and leptin is a hormone that is released in our bodies after a meal that signals satiety or fullness to our brains. So consuming fructose doesn't generate a normal response in our brain that tells us that we're full, so it makes it very easy to overeat. If that wasn't bad enough, continued consumption of fructose drives the development of leptin resistance, which results in persistent hunger and impairs satiety even with other foods, not just fructose. A study published in the American Journal of Clinical Nutrition found that just 7 days of high fructose diet increased lipid deposition in the liver and decreased liver insulin sensitivity. Now, how do we avoid fructose? Well, fructose is a simple sugar that's usually found in honey, fruits, and root vegetables. And humans have been consuming those for hundreds of thousands of years. But it did not pose a health risk until we started eating manufactured fructose and sugar at large quantities. Now, most fruits and vegetables contain fructose. However, our intestines can inactivate about 4 to 5 grams of fructose, which is the amount we usually get from vegetables. We get a little bit more fructose from fruits. However, fruits, like vegetables, are also consumed with a lot of fiber, which slows down the absorption of the excess fructose. In addition to that, many fruits are also rich in vitamin C, which blocks some of the effects of fructose and really negates any of the adverse effects of fructose that we get from fruit. So that brings us to the first food group that we need to avoid to reverse your fatty liver, and that is sugary drinks. Now, we all know about the dangers of sodas and soft drinks, but the sneaky drinks that contain a lot of sugars are juices, which are often promoted as healthy and frequently given to kids. If you drink orange juice, apple juice, tomato, cranberry, or any type of juice, please look at the ingredient label and see how many grams of sugars you get just from one serving. Do not be fooled by statements like it contains natural sugars or it has 0 grams of added sugars. It may be natural, but it's still highly concentrated and it's consumed without the fiber that you would normally get if you were eating a whole fruit. And it's a lot easier to overconsume sugars if we're getting it in liquid form as opposed to eating a fruit itself. Other drinks that are notorious for just being loaded with sugars are sports drinks and energy drinks. Now, the American Heart Association recommends eating less than 24 to 36 grams of sugars per day. But if you suffer from fatty liver disease, I would abstain from all drinks that contain sugars. Along the same lines, I would also avoid eating dried fruit, like dates or raisins or prunes.
Yes, they're natural and do not contain added sugars, but those natural sugars are very concentrated and do not have the volume of the original fruit, which makes it much easier to overwhelm our GI tract and later our liver with fructose and sugars. To support that, a study published in JAMA in 2019 noted that just 8 weeks of restricting sugars in adolescent boys to less than 3% of daily calories has shown significant improvement in hepatic steatosis. Another way to fix your fatty liver is to eat more protein, and it's especially important to eat more protein for breakfast or whatever your first meal of the day happens to be. A recent study published in Obesity looked at over 9,000 Australians and found that getting enough protein, especially for the first meal of the day, had profound effects on what people ate later in the day. And eating higher levels of protein for breakfast translated to consuming less food over the course of the rest of the day. But people that had a low protein breakfast were found to eat more energy dense processed foods and foods that were high in sugars. So if you find yourself constantly craving for those sugary or processed foods that will make your fatty liver worse, try to up your protein intake, especially for breakfast, and aim to get at least 25 to 35 grams of protein per meal if you're getting 3 meals a day. Getting enough protein will help you eat less